One is just a quick note that we are recording the session. It's really just so that folks have something to turn back to in case they weren't able to join us. So welcome. My name is Trinae Simpson. We can go to the next slide. I'm the Director of Grants and Programs with CareQuest Institute for Oral Health. And really, this is a really great opportunity. It's the first coming together of the work that Open was doing around its Take 20s and capacity building, plus the learning communities that CareQuest Institute was sort of pursuing in support of its grantees. So this is a really exciting time, and it's a new time for us. So prior to this year, the Learning Community Calls really served as a dedicated space for CareQuest Institute grantees to really share information, share learning resources on specific oral health topics, and create sort of that mutual beneficial connections and learning between grantees undertaking similar or complementary work. And so I'm really excited that we are able to welcome our broader sort of open colleagues into this work to really inform the structure and strategies associated with what we do moving forward. So that core purpose and intent of the Learning Community Calls will remain the same. So it's really a partner-driven initiative. It's responsive to the interest areas in the needs that come from you all and the advocates that are on the ground. On today's kickoff call, we will sort of narrow down some of the topics that we want to broach for the rest of the year based on your needs in order to effectively design our future meetings and make them of value to you, which is of utmost importance. And so with that, I just want to sort of frame the intent behind this sort of call, this kickoff call. And now I'll turn it over to Bianca Rogers. So thank you.
Thank you, Trinae, and hi, everyone. If we could go to the next slide, perfect. Well, it's great to see many of your faces and familiar names in the chat, as well as folks who I'm unfamiliar with. Thank you so much for joining us today. So before we get started, a couple of housekeeping items. As Trinae mentioned, this call is being recorded, and the recording as well as the materials will be sent to you as follow-up. We also ask that you please stay on mute today. We aren't in webinar mode. We are in a Zoom meeting, so appreciate you doing your best to stay on mute. And we also hope that you will drop any questions or comments in the chat throughout the conversation today. And we also encourage you to add your pronouns to your Zoom name. You can do that by hovering over your Zoom video and then clicking on the 3 dots in the right hand corner and clicking rename. So with that, I think if we go to the next slide, I will talk about our desired outcomes for today. So as Trinae mentioned, she framed what our call is has been in the past and what we will be doing now and moving forward. And so at the end of this call, it's an opportunity for open members as well as CareQuest grantees to connect. We will also be sharing an overview of the current oral health policy landscape to help us as we move into our discussions and conversations towards the end of our call. There's an opportunity for all of us to brainstorm and develop desired outcomes for this learning community. So as Trinae mentioned, this is built for you with you in mind. So we are excited to narrow down on what it is that you all are looking for to gain out of this experience, whether it's knowledge, resources, capacity building, skills, etc. And at the end, we're also going to cover a list of upcoming opportunities within both Open and CareQuest that we hope you will participate in. And now I have, now for introductions. So in the chat, if you could please add your name, your organization, where you're calling in from, and then answer either or both of these questions. So what are the things you do to stay sharp, personally or professionally? And what types of learning opportunities do not appeal to you? So that will give us a good reference of mind as we move forward. So I think if one of my colleagues can help add those to the chat, then I think we can move on to the next slide. And I am pleased to turn it over to Casey Wilson from Community Catalyst to talk us through the current policy landscape. So over to you, Casey.
Thank you, Bianca. I'm Casey Wilson. I'm a senior policy analyst at Community Catalyst, and I'm very happy to be here today. We can go to the next slide. So I'm just going to give a couple of quick updates and then a couple of pieces of information about some of the trends we're seeing. Some of you may have heard me talk about this in the recent past. So a couple of updates, things that I think are probably on people's mind. The president's fiscal year 2024 budget was released. There's not a ton of oral health, but there are a couple of things in there, which is nice to see. This isn't the actual budget that will necessarily get implemented. Some things will end up in the actual budget and some things will not, but it's a good indication of what the president and the administration are sort of paying attention to. So always helpful to see oral health incorporated. A couple of things that were included were mandatory funding for the Indian Health Service, and that includes an additional $45 million for dental services. This is really important because historically IHS has been funded through appropriations, which means that funds need to get appropriated every year. Funds will often run out before the end of the year, and that can leave gaps in critical services, including dental care. And then there's also some funding in there for dental residency programs. I'll talk more about this in a minute, but there's many indications that oral health is sort of on the radar, both for the administration and for members of Congress. So hopefully more to come this year. The other thing that I think has likely been on people's minds is the end of the public health emergency and the unwinding of the Medicaid continuous coverage provision. So I think folks know states were required to maintain their Medicaid rolls during the COVID public health emergency. Now that's starting to be undone, and particularly states can start to do redeterminations for Medicaid coverage. States have already started to do that. People in some states may have already started to get kicked off their Medicaid coverage. CareQuest released some really helpful data recently showing that about 14 million people will lose dental coverage specifically. This is obviously concerning both for general uninsurance, but also because we know that some proportion of people will transition to private coverage for their health insurance, but that doesn't necessarily guarantee that they'll get dental, even if they did have dental coverage under Medicaid. So concerning for coverage losses, and also important to make sure that people know what their coverage actually is, if they have dental coverage or not, if they do transition to a private insurance arrangement. So next slide, please. A couple of trends that we're seeing, I don't think will be surprising to anybody here. We're likely to see additional movement on dental coverage, particularly for adults. So I think folks probably know the Medicaid Dental Benefit Act and the Medicaid and Medicare Dental Vision Hearing Act have both been reintroduced. These are bills that have been introduced over the past several years. We're seeing some movement on them again. So the Medicaid Dental Benefit Act, some folks may have seen an open sign-on letter go around. Shout out to Bianca for that. That bill would make adult dental a mandatory coverage category in Medicaid, also includes some funding for that. And the Medicaid and Medicare Dental Vision and Hearing Act would add adult dental to Medicare. It would maintain the optional nature of Medicaid adult dental, but increase the FMAP to incentivize states to take that up. I don't think we're likely to see significant movement on either of these bills in this session, but it is a good sign, again, that Congress as well as the administration are paying attention to oral health. If folks were able to attend or watch the recording of the Senate Finance Committee hearing a couple of weeks ago, you'll remember some talk about Medicare dental, and in particular, Senator Elizabeth Warren came in with some pretty strong talking points about the need to add dental to Medicare. So it's definitely on the radar in Congress and within the administration as well. And then lastly, on the private insurance end, CMS is required to do a periodic review of the essential health benefits. And so they've opened that process up, and that creates a real opportunity to add adult dental where it's not already included, and expand coverage for people with private insurance as well. Next slide, please. And then the other trend we're seeing or continuing to see is in oral health workforce and interest in the healthcare workforce in general. So there was recently a Senate Help Committee hearing, and then a follow-up with a request for information on the healthcare workforce generally. It was a really broad RFI, and so that really opened up opportunities to talk about oral health workforce. Again, the Senate Finance Committee hearing touched on a number of issues that are important for oral health equity, including workforce, including coverage. Again, there was some really strong talk about the need for coverage in Medicare, and some talk about Medicaid and EHB as well. One relatively new-ish piece, the Notice of Benefit and Payment Parameters final rule was released, and not a ton about dental, but a couple of small pieces. The one piece that is somewhat related to oral health workforce is that there is an exception included for some standalone dental plans to not have to follow network adequacy standards. So if there is difficulty, the text says prohibitively difficult for the plan to find a network of providers, then they can be exempt from network adequacy standards. So just something to look out for. It's possible that some folks who are enrolled in standalone dental plans could end up in a plan where there's not a network of providers to meet their needs. So something that's on our radar. And then lastly, this isn't particularly new, but important, a HRSA report on dental therapy training, in particular funding for dental therapy training programs. There were some really key recommendations in that report, and we're seeing interest from the administration and continuing to push for some implementation of that as well. Next slide, which I think is the last one. Yes. Unfortunately, I have to hop off the call early today, but if folks have questions, I'll be on for a little while. But after that, if you have questions or want to connect, my contact information is on this slide. And I'll turn it back over to Bianca.
Thank you, Casey. And with that, I believe I'm turning it over to John and Francis to take us through our next section.
Awesome. Thanks, Bianca, and thank you, Casey. I learned quite a bit just in the short few minutes, but I think what's really understated is the fact that this work is still extremely important and has to continue going. So I'm really excited to see everybody on this call this afternoon. For those of you who I haven't met yet, my name is John Gabellis. I am also a Grants and Programs Associate here at CareQuest Institute. And really, I'm just here to talk a little bit about what our learning communities have looked like in the past, and really what our intentions are moving forward into this year. So next slide, please. Great. So the learning community model has been really great for us and for many of our participants over the past couple of years. And the reason why is because it's created a great environment for oral health champions and stakeholders like yourselves to really come together, to collaborate, to share information and best practices, but also just to spend time and support one another. We know that the work can get very hard and very difficult, and sometimes is challenging to keep that positivity and the motivation. And so these learning communities really served as a space that was beneficial and supportive to not only kind of raising awareness throughout the oral health field, but also helping folks develop more skills and a better understanding of how these different components of our work overlap and align to really help spur on the transformation of our oral health system. And so our prior model for these calls was really one that was focused on specific topics that our learning community participants suggested. And so we tried our best to be responsive, but typically the calls would be about 20 to 30 minutes of presentation, typically a didactic kind of format. And we would have some facilitated discussion following that presentation. While that model was very successful, and I think it was helpful for bringing a lot of folks on board in terms of their oral health and advocacy work, this year we're really hoping that this learning community will be even more responsive. And when we say that, we mean that the community and the teachings as well as the learnings are really driven by its members. And that includes our grantee partners as well as members of the open network. So what this means is that we're creating and hopefully sustaining a pathway for you all to co-create and share and really present useful resources and information to folks who are all passionate about oral health equity and making sure that the oral health system change that we're hoping to advance becomes a reality. And so I speak for the whole team, I think, when I say that we're very much looking forward to this year's learning communities and really hearing about the work that you all are doing and also providing opportunities for you to share some of that work more broadly. Next slide, please. I think I'll actually hand it over to Kate here to walk us through the Public Health Learning Agenda Framework. So go ahead.
Thanks so much, John. Hi, everybody. If I haven't already had the opportunity to meet you, my name is Kate Schechter. You can also call me Frances Walsh. I'll respond. But what I wanted to dive into next is thank you, John, Trinae, and Bianca for going over the kind of purpose for our overall learning community for 2023. And what you see on your screen now is how we hope to get there. So first off, I wanted to give a huge shout out to the Public Health Learning Network because they are the group that created this framework that we hope to move through today to support our process. And they actually curated a whole wealth of resources in their creation of this, from the theory of change model to Bloom's taxonomy. And we don't have time to get into all of that today, but we will be sharing all of the resources and slides after the call. So if you would like to dive in a little bit deeper, please do. So basically what you see across the top of your screen is if we were working through this process from start to finish, just today, we are going to be completing 1, 2, and 3. So as you probably have an inkling, if you've taken the survey already, we had a couple of pre-identified topic areas that have kind of proven over and over again to be topic areas of interest. And then we surveyed open members and grantees. And from there, that's that one section, the community or systems challenge. As we move through the call today, we are going to home in on what we hope to, how we are going to define the challenge. Basically, what is the problem that we see? And what kind of impact level or what outcomes we would like to get out of the learning opportunities based on that challenge definition. So after that, the staff are going to consolidate all of the incredible feedback that we hear from you today, and we're going to apply this framework to hopefully come up with the best learning opportunity possible based on the existing constraints, such as the virtual format and time. So that's what we hope to complete today and coming up. Next slide, please. And I'm going to share very quickly 2 of the tools that we can use in our discussions later to think through what impact level we want to see come out of whichever topic area is really speaking to you today. So when we're talking about impact area, we are thinking about the individual level, and those are things like learning for knowledge change, all the way to the impact level of the community or public health, and learning for cultural change. And you can see that this tool does show things like the length, scope, dose for each of these impact levels. And obviously we will not have the capacity to do learning for cultural change with a multi-year community, multi-sectoral commitment. But this is something that is helpful in framing our thinking. Next slide, please. And this is simply a deeper look about how the impact level can be taken into account when we are thinking about what types of changes we want to see. So if we are looking at an individual level, again, the goal that we would like to see coming out of a learning opportunity would be things like improved knowledge, skills, and learning. If we are thinking about an impact level at the organizational level, we're looking at policy and practice change. And then if we're looking at the community level, we're really shifting culture. So when we move into our group activity and we're discussing what kind of impact we want to see come out of these learning opportunities, these are tools that we can use to support our thinking. And with that, I think I'm turning it back over to John.
Thank you, Kate. And so just wanted to spend a couple of minutes going through some of the survey results. And as you all know, or may know at this point, we sent out a survey to our grantee partners as well as open members a few weeks ago, really in preparation of this call and in preparation for the learning community calls for the rest of this year. And really the two questions we wanted to know from you all were, where do you rank these subject areas, these topic areas that we identified really based on your feedback from past years of our learning community? And so we wanted to share some of those results so that you guys could get a sense of who else is in the room, essentially. And we're very privileged, I think, to have a lot of subject matter experts, but a lot of curiosity as well. So if we could go to the next slide, please. Great. So as I mentioned, there were a couple of key prompts, and the first was really focused on everyone ranking these 4 topic areas by their level of interest. And I just want to double down on what Kate has already mentioned, is that these 4 topic areas are in no way meant to be an exhaustive list of all of the different areas or angles for us to kind of pull as levers in this oral health systems change work. But these were the predominant themes, without a doubt, based on some of the survey feedback that we've gotten from community members in the past. And so, as you can see, we've received 33 survey responses, and the results suggested to us that most of the respondents were interested in things like advocacy and policy, followed by DEI practices, which includes how that's operationalized at each one of your organizations. Then community engagement and oral health workforce development were also some topics of interest. So generally speaking, I think there's a pretty good balance of interest levels across these 4 areas. And I think it's also exciting because this speaks to the fact that while these topics are somewhat different, they're certainly related, and there are some opportunities for us to strengthen our muscles in one or more of these areas. Next slide, please. Thank you. And so the second prompt was really focused at you ranking these 4 topic areas by your levels of expertise. And so again, out of 33 responses we received for the survey, it was interesting to see that the expertise levels were almost an inversion of where people's interest areas are. So calculated by looking at only 1s and 2s in terms of the responses, we see that the lowest level of expertise is really in this DEI practices and how that's operationalized, as well as really bringing community engagement practices to life in the context of your work. So I think that there are going to be a lot of ways that we could interpret this data, and certainly it's only representative of a portion of our larger learning community, but it gives us a sense of where people's interests are and where we might be able to also leverage some of your skills and talents for the benefit of the larger learning community. Next slide, please. So finally, I did want to also mention that on the survey, there was also an option for folks to submit another non-listed topic area of interest for the learning community this year. And so we certainly wanted to address those and acknowledge those responses as well. And so you can see on the slide that there were several suggestions and a lot of interesting and timely suggestions at that. The way that we've categorized them on this slide is really trying our best to kind of identify which of the 4 topic areas or themes these bullets would ideally or probably fit within. But I think this is also something that we're also excited about exploring with you all this year, is where some of these bullet points may cross over or overlap with a number of different topic areas, and getting some perspectives from you all about how we're going to really respond to everyone's desires or the group's desires to learn more about some of these more specific topic areas. So really, we're going to dive into a lot today in terms of the discussion, and I'll turn it back over to Kate, but just want to thank you all for responding to the survey and continuing to really be engaged as we develop this community of practice.
Thanks, John. And double click on that. So happy to be here and happy that everyone's interested in participating today. So let's get to the meat. Let's get to the fun. We are going to go into breakouts. Everybody's favorite thing. Woohoo! I saw it in the chat. So what we are going to be thinking through when we go into breakouts, and you're going to use your feet to vote into whichever topic or area you are most interested in discussing today, is we are going to talk through these three questions that you see here. What type of community or systems challenge are we addressing? Basically, what is the issue? What is the problem we are trying to solve? Is it technical to adaptive? Number two, what outcomes do we hope to come from the learning community? That's the whole slides that we had with the icebreaker about what type of impact we would like to see if we want a change in knowledge, policy, or culture. And then what additional assets or resources would support those desired outcomes? That's like, what type of speakers would you think would be a great fit for that? Any additional tools you'd like to share, etc. Next slide, please. And you will have this template in your breakout room. All of the breakouts will be staffed by staff who will be facilitating and content managing or taking notes, so that you can really focus on thinking through what is that challenge or issue or problem that we would like to discuss. What goals or impact would we like to see come out of the learning opportunity, and those assets or resources. And what you will see on your breakout in every room is that there is this example there just to help get your brain going. Please don't feel that your language has to match this in any way, shape, or form. And I think that is it. And we're going to go into breakouts. But any questions before then? All right. So what we're going to ask folks to do is look down at the bottom of your screen. You should see the Zoom bar with breakout rooms. And in that area, you can see the different topics. So they are abbreviated. We have community engagement and cross-sectoral collaboration, DEI practices, policy and advocacy, and workforce. And at this time, you can go into whichever one of those rooms you are most interested in joining. Thanks, everybody. Look forward to catching you on the flip side.
And let us know if you need help getting into a room, and we can do that manually for you as well. Don, I think you want to go to workforce. Am I right? Oh. Yeah, you just went.
I may need help. I don't even see the options of the breakout rooms.
Oh, no problem, Melissa. Which one did you want to go into? Community, DEI, policy, or workforce?
Workforce.
Okay, great. I will get you in there now.
Thank you, Bianca.
No problem. Hopefully you saw it come up.
Can you put me into
Hey, Ellen.
Hey Bianca, how are you?
Good. Which one would you like to join?
Policy?
Policy. Okay. And you're off.
Yay.
Awesome. Okay. I am gonna go help Christina in policy.
Because
But
it
I
looks like
will
the biggest one.
There's 16 in policy, they're 13 in workforce. The other
Okay.
ones are 6 and 5, so we're good. Who
Okay.
else is helping? Melody, are you gonna go help in workforce?
If you'd like me to, that's where I will go. Popping in
Okay,
now.
that would be perfect. I'll assign you there now.
Thank you.
Thanks,
Okay, and
Melody.
then thank you, Melody. And then I'll join Christina, and then I'll come back to do a 10-minute warning for folks.
Cool.
Okay, see you guys.
Thank you.
Wait, can I go to a room? I don't know if I can.
Courtney, just real quick, do you want to go to a room
Oh yeah.
to
yeah.
listen in, or?
I feel like it will be too much advanced information.
Okay,
Like it will just confuse me more.
okay, no worries.
I don't know if I can join a room. Because I'm like the keeper of the breakouts.
Should we
Uh,
like, I can message them and be like, do you need anything?
Yeah, yeah, message. I think Christina should ask for help and then maybe I can go in there. Like there should be a button that says, and I think that will prompt me to be able to go. Oh, wait, maybe I can figure, maybe I'm dumb. Okay, I'm gonna see if this works and I'll be back if not.
See that? It was. Are you familiar with Zoom? Like, did you guys use that before?
Yeah, we were kind of similar setting where we use Teams for internal, but
Okay,
Zoom for external.
cool. Courtney, while you're on here, do you mind sending me the link to the RT meeting, that agenda?
The team meeting agenda.
Yeah, from Grant's team from yesterday. Oh, God.
I just sent it.
Thank you.
Of course.
Hi. My computer shut down and I got kicked out. Do I just go to the breakout rooms tab to rejoin? Yeah. Okay.
Yeah.
Okay. Thanks.
Hi, Eddie. All right, bye, Eddie. Well, I have you on here, Courtney. Can we start at 4:15?
Yeah, that's fine.
Cool, thank you.
Of course.
Mm.
Done.
Hello, hello, everybody. Welcome back. I think that might be all of us. So as my colleague is loading up the slide deck for our final close, I just wanted to make sure that the staff who has taken great notes, and I know I was also scrambling to get all of that good content together, we'll drop a summary for you all in the chat, but we have 0 minutes to talk about what happened. We will package it up and make sure that gets right back out to you. And so we'll have that in the chat coming to you soon. Next slide, please. So we have so many wonderful upcoming opportunities, both on the open side of things, on CareQuest Institute side of things. Our network response teams, or NRTs within open, those that are related to the topics we covered today that are upcoming. On May 9th, the Health Equity Super Network Response Team, they will have their kickoff call where we'll brainstorm a bunch of different opportunities for the year. So join us May 9th if you're interested in that. Also, April 28th is the next Policy Network Response Team call. And again, there are many, many more network response teams. If you're interested, you can log on or join open at communities.openoralhealth.org. If you're not already on there, but you'll find a wealth of resources and ability to join any team that you're interested in. We also have an anti-racist organization policies cohort that will be launching in tangent with the Health Equity Super Network Response Team. That will be coming soon. If you didn't see last week, I believe it was a save the date sent out for Open's virtual Hill Day. That will be September 12th and 13th. And the Open annual meeting, those dates will be coming very soon. I know it will be either late October, early November, in that range, so stay tuned. And I will pass it off to Christina to let you know about the CareQuest Institute wonderful opportunities coming up.
Thanks, Frances, and thanks to everybody again for joining us today. We really just wanted to highlight all of these opportunities for engagement, and also so that you know that we do not intend to be duplicative with this learning community, but really hope that the learning community is a complement to all of the opportunities offered through Open and through CareQuest Institute. So from CareQuest Institute, from our side of the house, we have ongoing webinars. We have them every other week or so, and we will drop a link in the chat. Those are really exciting, and I believe the upcoming first two are about delivering care to patients with autism, as well as tooth decay for the older adult population. So some really great oral health learning there. I also wanted to give a plug for another exciting opportunity that we have coming up soon, which is a dedicated request for proposals that we will be launching in the next month or so, really dedicated to engaging community meaningfully in care transformation efforts. So that could be, and certainly not limited to, but includes value-based care, medical dental integration, minimally invasive and non-invasive dentistry techniques. So we look forward to being able to communicate with you in the upcoming month or so about that. Keep your eyes peeled on your inbox. And then we've set the learning community dates for the remainder of the year. You'll see some registration links coming out on Open Communities, as well as directly from me for through our network of grantees. And we're really, really excited to take all of the information that you provided today and foster some really meaningful and helpful learning opportunities and opportunities for us to work together in some of these common challenges that we're facing in oral health systems change work. So we are a little bit ahead of time. I want to make sure we have responded to folks' questions. Are there any inquiries about any of the upcoming events or opportunities?
Where will the annual meeting be held? Or do you know that yet?
We don't have those details yet, but coming out soon.
Is that going to be an in-person convening?
Also coming soon.
Okay.
The decision hasn't been made yet, but very, very soon, we will be sending something to your inboxes.
Thanks, Bianca. All right. So, as I mentioned, we will be synthesizing all of this great information and input that you've provided today. Quick plug before we wrap up. We will be sending out an evaluation link. It will also be dropped in the chat if you just want to take care of it right away. Want to make sure that these opportunities are as helpful to you, the network, as possible. And please let us know if you have any questions or any thoughts about the upcoming opportunities that you didn't get to share today, but really appreciate you all being here.
Thank you all so much.
Thanks, everybody. Great seeing you.
Thank you. Good to see
Bye.
everybody. Thank you.
Bye. Take care.